So when you attend for your colposcopy appointment, there will be a trained colposcopist who will do your examination. There'll also be 2 trained staff who are in there to assist with the equipment. We are a training hospital, so we do have trainees who are sometimes in clinic, but we will ask your permission beforehand. But it's absolutely fine if you don't want them to attend. We can just ask them to step out for your appointment. You can bring somebody with you to your appointment if you wish. We do normally recommend just one family member or close friend. They can come in with you while we take a history and explain everything to you, and also for the examination. So if you are on your period when your appointment is due, that's absolutely fine, still come for the appointment. We do appreciate that sometimes you can feel a little bit embarrassed, but honestly it's nothing to be embarrassed about. We would still recommend that you come and get the appointment done. So when you attend for your appointment, we do recommend to wear something light, nothing too heavy, no thick jumpers or anything like that. You can also wear a skirt, and then you can just pop that out of the way when we do the examination, but we can offer you a gown just to cover yourself over. So when you attend for your appointment, you don't need to avoid anything, just live your life as normal and then attend on the day. If you do have a colposcopy examination, you can go home and continue life as normal. But if you do need a loop biopsy treatment, for 4 weeks following the procedure, we do recommend that there's no sex, no tampons and no heavy exercise. You may want to take the rest of the day off following your appointment, however this isn't essential to see how you feel afterwards. Everybody is different, but some people can describe the procedure as uncomfortable. So depending on what you have during clinic, will depend on whether we need to follow you up in clinic, but we will go through everything with you when you have your appointment. So if you don't attend for your initial appointment, we will send you a second appointment. However, we would appreciate it if you could let us know, as somebody else could have actually attended for that appointment. So the actual smear tests aren't suggesting that you have got a cancer of the cervix. However, it is suggesting that there's pre-cancerous changes, and if left untreated could develop on into a cervical cancer. So it's really important that you do attend for your colposcopy appointment. We'll be in touch with results via letter or phone call, usually within about 3 to 4 weeks of your colposcopy appointment. So usually this treatment is the loop biopsy treatment, which is carried out in the clinic on the same day, and that normally is enough to remove all of those cancerous cells. However, on a rare occasion, they may need more intervention and more treatment, but we will support you through that. So the staff in the department are very supportive throughout the process in colposcopy. However, we do have recommendations of forums, chats where you can join and speak to people who've actually gone through similar situations. So sometimes you might find yourself where you're pregnant and you've recently had an abnormal smear. However, we would recommend still coming for the procedure. The colposcopy examination is safe during pregnancy. We wouldn't be doing any biopsies or anything like that, but just to check the cervix that everything looks okay and reassuring for yourself. If you have experienced anything traumatic, then please contact us prior to your appointment, because we are here to support you and we can offer longer appointments if needed. So there is lots of public transport options. There's also car parking facilities on site. However, if you are going to struggle to get here to the appointment, please contact us beforehand and we can talk you through some options. Please contact the department beforehand, before your appointment, and the nurse and staff are more than happy to talk you through what to expect during clinic. If you would prefer to see a female member of staff, please contact us on the number provided within the letter prior to your appointment, and we can rearrange this because this can't always happen on the day. If you're a smoker, we do encourage you to stop because smoking does weaken the immune system, because it can take you longer to fight off the virus, and if the virus is left untreated, this could go on to cause pre-cancerous abnormality on the cervix. If you do experience any bleeding in between periods after sex, please contact your GP. If you have a physical disability, we do have the equipment within the department and the staff here who would support you through your appointment. Or if you have any questions or concerns or just want to talk to somebody prior to your appointment, please just give us a call. If you do have a precancerous change which requires treatment, we normally give you a call to discuss this in more detail and offer you a follow-up appointment to attend clinic. If you do require further resources while you're waiting for your results, please do visit the Northumbria Healthcare website for further links and advice. We do have a specialised chair within the colposcopy clinic which can recline you to get you into position to make it as comfortable as possible throughout the procedure. Anybody under the age of 55, we do ask you to bring a urine sample on the day of your appointment. This could be collected in one of these pots, and you can get one of these containers from your GP surgery, and we do ask that you do a urine sample on the day of your appointment. The reason why we ask for a urine sample is because we do a routine pregnancy test prior to any colposcopy procedure. After a colposcopy examination, we wouldn't expect you to experience any bleeding. However, if we do a loop biopsy treatment, sometimes you can bleed for up to 4 weeks afterwards, and we do provide sanitary towels in the clinic.